It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network. Of course, Jim, featuring some of the best doctors in all of the Dallas and Fort Worth area that are helping to change people's lives.
And speaking, Candace, of helping change people's life, how about we'll open with one of the top plastic surgeons in the entire Dallas-Fort Worth area. It is Dr. John Barnett.
I didn't have Poland syndrome, but it was like it, where one breast is significantly bigger than the other. So I was like a B and a C. It affects everything. The way you dress, the way your wardrobe is, the things you can and can't buy. And as a woman, you want to be able to just go buy it because you like it and you want to wear it, not because of the way it's shaped or formed around your breast area. I just got tired of feeling like that, and I knew that after having a child, it still didn't change. I finally said enough is enough, and I went and saw Dr. Barnett.
Kayla was a special case. This was actually more of a reconstruction than it was simple augmentation. There was nothing simple about that case. She had vast asymmetry in the breast. Asymmetry means one's not the same size or shape as the other. In Kayla's case, this one never developed. And this one was what you'd call a tube sock. Elongated, hanging down. This one was barely there. Usually should have been a two-stage operation. And I told her going in that, I can do so much, but probably you're going to need another operation.
We talked about it and looked at the pictures, and the kind of surgery I needed and required with what I had should have been a two-step, possibly three-step operation. And what Dr. Barnett did was just a one-step operation. And that's all it took.
I was able to, in one stage, create a matched pair. It worked out beautifully. It's been a year now, and she looks fabulous, and she's happy as a clam. Is it rewarding? Yeah, really is. That's a special case. Dr.
Barnett treats his patients like family. He will give you his cell phone number to make sure that you can always be in contact with him if you ever need anything before and after surgery. I'm happy and glad to know that I safely chose him. I've had no complications. You can't even see my scars. He changed my life forever. It was the best decision I ever made.
As I was aging, I guess, my teeth weren't as pretty as they used to be, so I found that I wasn't smiling as much as I used to.
Sandy's a very beautiful lady. A lot of the patients I see, probably the majority of patients I see, are women, over the age of 40, who a lot of times, they take care of themselves, they stay in shape, they look great. But there's just some things they want to do to try to look younger. And for Sandy, getting her teeth whiter, straightened up a little bit with the veneers was perfect for her.
I've seen a lot of Dr. Lewis's work and have been so impressed, so I came to see him. And I'm so glad I did, because now I smile all the time.
It just really works great for a lot of people, and she was a perfect candidate for that. It's amazing to me that doing the veneers like we did for her, which is a pretty simple 2-visit process, 2 or 3 weeks apart, what a difference it can make in how someone looks. I mean, literally 10 or 15 years younger.
It's painless, it doesn't take long. Dr. Lewis is very sensitive to your feelings, how you want to look. He's a good listener He listens to how I wanted my smile and my teeth to look, and he did exactly what I wanted.
It can be done so to where it's not like people look at you and go, wow, where'd you have your teeth done? But they look at you and go, man, you look great. You know, what have you done? Have you been working out more? Or you just look, for some people, if their teeth are really bad, yeah, it's going to be a noticeable change. But for other people, it's just one of those things to where you just look good, you look more alive, you look more refreshed, you just look better, but it's not just a glaring, oh, what'd you do to your teeth, you know?
My family would say, okay, what did you do? Something's different. Your smile is beautiful. Did you get your hair cut? I just feel so good about my smile now. Smiling's good. I'm not a big fan of going to the dentist, so this was a big deal for me, and I would do it again in a heartbeat.
For more information on any of the doctors you've seen on today's show, be sure to check out our website, bestdocsnetwork.com. And now we're going to check in with our next best doctor. It's bariatric surgeon from My Bariatric Solutions, Dr. Scott Stowers.
At the age of 25, about 15 years ago, I was diagnosed with high blood pressure. And with that high blood pressure came 3 medications. I had a family history of heart disease and had seen a cardiologist since I was 10. Had, just a lot of weight gain with having 2 children. My grandmother had both legs amputated with diabetes. Then my father has diabetes and, just the family history.
Yeah, Lisa is an example of one of our patients that came to see me for the typical problems of inability to lose a significant amount of weight that would affect her health.
Several different doctors for 15, 20 years had been saying that, if you could lose 70 pounds and keep it off, you would get rid of the high blood pressure. There is a huge possibility that you will not be diabetic, that even your heart condition would be just almost completely resolved, and you could even get off of all of the medications. So I chose the gastric sleeve procedure, which for me was just the best choice.
For a sleeve patient, they typically need to be at least 70 pounds overweight. Sleeve is a relatively new procedure that we do where we take out about 80% of the stomach. The whole concept of the surgery is just restrictive in nature, where they essentially are on a low-calorie diet for the rest of their life, but they're not hungry all the time.
I came in, I met with the actual surgeon. I actually sat down with Dr. Stowers and he was amazing. Somebody who just totally makes you feel comfortable. He answered every question. He was very honest with me and reassuring. It was just beyond belief that he was able to make me feel so comfortable. At 1 week post-op, I was literally off of all of my medications. It had already made that big of a difference.
Within a year, she'd lost about 80 pounds.
I've reached my goal weight. It's been great going from a size 18-20 and an extra large shirt to a size 8-10 and a medium shirt. I never thought I'd see that again, so it's been really exciting.
Is your energy lacking? Though it may be the last thing you feel like doing when you're tired, exercise. Even a brisk walk can be more effective than a nap or a cup of coffee at fighting fatigue.
I had my gastric bypass in May of 2011, and after 2 years I lost 100 pounds. After losing 100 pounds, I had a lot of excess skin on my belly. I've always been big around my belly area, so that's where I carried all my weight. I felt very unhealthy with it and wanted it removed.
The problem is when you lose that much weight, your body and your skin cannot go back to where you would like it to go back without help. And there's no way with exercise that you can get rid of the extra skin that's hanging, that has been stretched out, often has a lot of stretch marks. And in some patients, you do need to do a brachioplasty or remove skin from the arms. In some also you need to do a breast lift. In some you have to do a facelift to correct the extra skin around the face. So everyone's a little bit different. In Karen's case, Her major problem was her abdomen, where she had all this extra skin and this pannus that she wanted removed, that she could not get rid of, despite the fact that she ate well and despite the fact that she was working out regularly.
When I came to see Dr. Azouz, I weighed 151, and that was because I was still carrying all the fat that was around my belly. He had explained to me the different procedures that he has. He explained to me the tummy tuck in particular. It was what I was interested in. When he examined me, he found a hernia, which he repaired while he did my tummy tuck. Dr. Azouz cut off 8 pounds of fat from my belly.
And of course, her skin was very poor quality. It was all had been stretched out from when she was a size 24 or 26.
Once I had my tummy tuck done, I dropped like 4 sizes right away. Dr. Azouz told me when I had the tummy tuck, I would lose another 20 pounds plus what he cut off, and I did. I started at 248 before my weight loss, and after my tummy tuck, I'm now at 124, size 0.
Don't forget, for more information about any of our outstanding doctors you see on today's show, even request an appointment, you can head to the website, bestdocsnetwork.com. That is bestdocsnetwork.com.
And now our next life-changing story is going to be with spine surgeon Dr. Michael Rimlawi.
Well, in 2004, I had started having sciatic nerve problems running down my right leg, and went to the doctor several times, and the normal thing is to give you some muscle relaxers, some pain pills, but the problem persists. It got worse. I had a cartilage shaved off of my disc in order to keep it from rubbing the sciatic nerve. Even after all of that, it came back again.
Brad came in to my office complaining of a lot of back pain, weakness down his leg, and shooting pain with numbness down his leg. And after looking at his MRIs, his x-rays, he did have pinching of his spinal cord. He did have a lot of arthritis. Pretty much the disc is like the cushion in your back, and his disc had collapsed over time, and then a piece of disc had come out and was hitting his nerves, and that's what was causing the leg pain. One of the important things for Brad was that in his business he travels all over the world, and he really couldn't afford to be laid up in the hospital for a week or take a year to recover, and he said that's what he was told at other places. So we do this minimally invasive T-lift procedure, and what's really awesome about this procedure is usually this type of surgery, surgeons will usually make a big cut in the patient's belly, fuse them there, then they actually flip them around and make a big incision in their back, and a lot of muscle dissection. And what's nice about how we're doing it now with this minimally invasive T-lift, really we do it all through these little tubes and cameras, and it'll be a couple incisions about this big, and we go in between the muscles instead of cutting the muscles or retracting the muscles. So patients have really almost no blood loss. Surgery, instead of taking 6, 7, 8 hours, takes about an hour and a half. Instead of being in the hospital for 5, 6, 7 days, they go home the same day. We were able to perform that minimally invasive T-lift on Brad, and he was able to go home the same day.
After my procedure with Dr. Rimlawi, I'm 100% healed. My back is completely, fixed. I have great movement. That was another thing I was majorly concerned about, was movement, because people were saying, well, if you get your spine fused, then you won't be able to move like you were before, which, it's not at all the case.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Most people don't realize, but the largest organ in your body is your skin. Without your skin, you actually can't live. And there are some people, unfortunately, who do have serious problems where they lose large areas of their skin and they actually have very tough time surviving. How do you take care of your skin is a good question. It sort of depends upon where you are in your life, for example. Obviously, if you're a little baby and you can't take care of your own skin, you need your parents to make sure that they change your diaper frequently and use moisturizers and keep it from getting an infection or an irritation. As you get older in your teenage years, you need to make sure that you take care of your skin that may be too oily and whatnot. You may be prone to acne, so you need to wash your skin and use appropriate acne medications and things like that if necessary. As you get older, you need to make sure that your skin doesn't get too dry. So you don't want to bathe too many times with harsh soaps and waters, and your skin can get dry and then develop rashes. And then all throughout your life, you want to make sure that you don't get too much sun exposure that can lead to skin cancer and melanoma. As our skin gets older, especially if we've had a lot of sun exposure, our skin loses the elasticity of the skin. It becomes, instead of when you're a little young person, if you pull on somebody's skin, it kind of bounces right back and goes back to normal. As we get older, if you do that, it takes a little bit longer for it to go back, and then as time goes on, you start getting wrinkles and your skin loses a lot of that sort of tensile strength that it once had. A lot of that is normal aging, but if you go out into the sun, it's much more accelerated. The scalp can be the site of a lot of conditions also, and if you've never had any disease in your scalp, you might not think about it. Probably the most important one is what's called alopecia. If you're losing your hair, especially if you're a woman that has got a lot of hair, or even if you're a male that you're going bald. I mean, that's really distressing to a lot of people. In addition to that, there are a lot of inflammatory diseases that can affect the scalp. Folliculitis, psoriasis, seborrheic dermatitis, and then there are some really sort of terrible diseases that sometimes can get into the scalp. There's a thing called dissecting cellulitis, which can cause really large, boggy areas of inflammation, and pus can drain out of the scalp. It's almost like severe acne, but it just affects the scalp as well. So if you do have something up there, that's probably a good idea to get checked out by a dermatologist, and they can make a diagnosis for you, and then it can be treated appropriately.
Chest pain can be a scary thing. There are bad causes of chest pain and not so bad causes. So how do you know the difference? Well, generally the bad causes of chest pain, for example, a heart attack, occur with a gradual onset. For example, the discomfort comes on gradually and then goes away gradually. It's usually exertional when you do things like run up a flight of stairs. It's usually dull, not sharp, and that means not like a knife. Knife-like chest pain doesn't tend to be heart-related. Also, if it's heart-related chest pain, you'll tend to get other symptoms like shortness of breath, you'll get a cold sweat, you might even get nauseated or have the pain go to your jaw or to your arm. Now, non-heart related chest pain is a lot easier to figure out and yet not nearly as scary. For example, it's usually sharp, it's usually sudden, it's usually aggravated by motion. For example, if you have chest pain that's worse when you move or reach or bend or arch your back, that's generally muscles or nerves, and that generally lasts longer. So that's the way you can figure out whether it's heart or not heart, that and whether it's exertional. If you go up a flight of stairs and your chest pain gets worse, and that's pretty predictable every time you go up a flight of stairs, that may be your heart. Check that out, especially if you're older.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
Brushing your teeth can prevent stroke. People suffering from gum disease are twice as likely to have a heart attack or stroke.
For more information about any of our outstanding doctors you see on today's show, even request an appointment, the place to go is bestdocsnetwork.com. That is bestdocsnetwork.com. Right now, the place to go is our next best doctor. It is prosthodontist, Dr. David McFadden.
I had a bad problem of grinding my teeth. And 30 years ago, I had some beautiful teeth. And, you know, they slowly got worse and worse and worse. And then, of course, I started having cavity problems. And my regular dentist told me, look, they're not going to last your lifetime. So you're faced with either dentures or you know, redoing your mouth.
Many patients find us because they're at the end of the road on their dental history. They have neglected their teeth, or they've had habits that have caused their teeth to wear down to the point where they know they have to do something. And they present sometimes after many decades of problems, and they're ready now to fix those problems the best they can afford to. A lot of the patients fall into the full mouth reconstruction category, which means they need every tooth in their mouth addressed in their treatment.
When I finally went to Dr. McFadden, I was looking to him for a permanent solution and something that would last the rest of my life, obviously. And then calmly brought me into his office and literally wrote down on a piece of paper, here are 3 different proposals. After weighing it, I decided to take the highest cost option. For me, which was to put crowns on every tooth.
When Bob came to the practice, it was a really fun appointment. He was instantly charming and fun to be around, and we became friends throughout his treatment. When Bob arrived, he had had 4 decades of tooth grinding and ended up with almost no tooth structure left, and his wife hated his smile. We were able to use all of his teeth and perform certain procedures to allow him to keep his natural teeth and improve the way they look through crown treatment. One of the funniest things about Bob is that he carries his before and after pictures on his iPhone. He shows everybody. He shows people that don't care at all what his teeth look like and how great his teeth look now.
He cares, incredibly cares, how good your teeth are. A little bit obsessive compulsive he is, but it works out in your mouth to be beautiful.
Don't skip breakfast. Fiber in the morning means less hunger late in the afternoon, when you most likely feel tired and gorge yourself on sugar. An early start on eating also keeps your metabolism more active throughout the day. Breakfast eaters are thinner than people who just rush out the door.
I'm the office manager for Dr. Kathy Toller. She is a neurologist, and her focus is on seizures, multiple sclerosis, and work injuries. The reason we choose to work with Preferred Imaging is because they are more customer service based versus a hospital or any large facility where the patient needs the facility versus them being treated like a customer. When you go to Preferred Imaging, they are treated more like they are a customer.
I basically do all the scheduling for neurosurgery for any testing that they need. I refer out. I like using Preferred Imaging because they are really good at scheduling the patients right away, and also working with their financial any financial problems that the patient might have. It makes my job easier.
Preferred Imaging handles everything, including authorizations, verification of insurance. So they essentially take all the work. We send the order, they contact the patient, they get the authorization, they get the patient in, they call us, fax us, let us know that it has been scheduled. So basically it frees the physician's staff to do other things.
I actually just send over the paperwork to them. A lot of times they can actually get the pre-certification for us, and they call the patient for us so we don't have to be calling back and forth. They actually call me and let me know when the patient is scheduled. That way I can get the quick response or the appointment back to the patient.
A big benefit with Preferred is that we are constantly getting the update. We're getting the fax update, the online update, and it's usually, the turnaround is about 24 hours. But they also offer a stat call where the physician will be called on their cell phone if there is some urgent matter regarding an MRI or scan. Preferred Imaging has 14 locations throughout the Dallas-Fort Worth area, and that makes it really convenient for us since we have 2 locations.
Hi, my name is Dr. Michael Rimlawi. If you've been told you need traditional back or neck surgery, you need to check out my latest videos on minimally invasive spine surgery on bestdocsnetwork.com.
We have a very active skincare department as part of our aesthetic practice. When patients come here, we are very proud that we can offer them either surgical rejuvenation or skin care.
I think skincare is your icing on the cake. It's going to help address whatever issues you have for tone and texture and evening out skin color.
Some people are just looking for a more youthful look. They don't really need surgery. So these different facial fillers actually enhance their face and make them look a lot younger.
That in conjunction working with Dr. Wilcox and his specialty of surgery, kind of lifting, and Vicki helping plump out and fill lines and smooth lines, the whole thing just works really well together.
Every patient is specific and every need is specific for that patient. So many of them will tell you, they'll tell you, what they're looking for, and then you just kind of go from there.
Consultation entails me examining the skin, and then I can tell you what I think would be the best protocol for what you have going on, whether it's wrinkles or acne scarring or active acne or sun damage. It's usually a program of products, lasers, and chemical pills that will progress along this way to get your skin nice and pretty and glowing.
Many of my patients range from the age of 25 to 70, and I am seeing a lot more men these days. They too want to look better and enhance their appearance. They're competing a lot of times with a lot of guys that are younger than them, so they too want to look really refreshed too. These treatments stimulate collagen and slow down the aging process. They don't correct, they actually improve your overall appearance.
If we can offer either skincare or surgery, then the patients are comfortable knowing we're going to offer them the best treatment for their particular problem.
Carpal tunnel syndrome basically is a problem where you have a nerve that's here in your wrist. That nerve shares a common space. It shares it with 9 tendons. When those tendons swell, that soft little nerve gets pinched. The patient can then begin to have numbness and tingling, and if it's there long enough, can notice that his grip strength or her grip strength has diminished. It's important to treat carpal tunnel syndrome early and not wait too long, because the longer that nerve is pinched, the greater the chance that nerve can become permanently damaged if left untreated.
I've been dealing with hand numbness and pain in my hands and fingers for probably 15, 20 years. It progressively got worse, and it got to a point where I couldn't sleep anymore. I couldn't write much more than a check out without a pen falling out of my hand. I would run my fingers through my wife's hair and not be able to feel it on my fingers. And I was missing out on a lot, keeping me up at night or waking me up at night. It would hurt all the way up into my armpits.
When Steve came to see me in the office and he told me his story, it definitely sounded like he had carpal tunnel syndrome. After examining him and after getting a nerve study to confirm what we suspected, it came back positive for carpal tunnel syndrome in both of his hands. So we proceeded to do the surgery to treat his carpal tunnel syndrome.
The procedure we went with was the endoscopic. I could sleep at night now. I can feel my wife's hair when I run my hands or run my fingers through her hair. I'm doing just about everything I used to do before.
The good thing about endoscopic surgery is instead of waiting this a long recovery after one surgery for one hand, we operated on Steve within a week and a half after his first surgery. So he basically had both of his hands done in 1 month.
I wish I hadn't put it off for so long. I don't know how many things I put off because I couldn't use my hands like I wanted to before. You actually feel my hands and do things, and it doesn't hurt to pick up a pair of pliers or pick up a wrench. I'm glad that I found Dr. Ray, and everything's been great since.
Well, that'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas and Fort Worth area, Jim, that are helping to change people's lives.
And don't forget, for more information about any of these outstanding doctors, even request an appointment, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com.
And as always, if you have a question or comment for us, or if there's a doctor that's helped change your life, we'd sure love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.